You've seen our research on social media. Now, join us as we dive deeper into the public health topics of our time, featuring new studies and findings generated by our faculty and researchers committed to advancing health equity. From the Department of Population and Public Health Sciences at Keck School of Medicine of USC, this is Preventive Pros, the podcast.
My name is Rita Burke, and I'm an associate professor of Clinical Population Public Health Sciences, and I also have a joint appointment in the Department of Pediatrics. So I focus on pediatric disaster preparedness and injury prevention, and today we'll be talking about some of the health disparities that exist in pediatric disaster preparedness. Disaster management deals with every phase of the disaster management cycle. That includes mitigation, trying to lessen the impact of a disaster, preparedness, making sure we're prepared for when a disaster strikes, the response phase, so when something actually happens, how do we get help to the people who need it, recovery, how do we build back after disaster. And recently, we've added another phase to the disaster management cycle, which includes resilience. So making sure that communities and individuals are empowered to have the knowledge and the resources to build back after a disaster and not necessarily rely on government and other resources. My first introduction to emergency management was when I was doing my master's and my internship at the Los Angeles Department of Public Health. I was there during the anthrax attack. That little envelope completely changed my life, and I was in the thick of it. I got to build up all the syndromic surveillance systems, build up all of the capacity to enable our county to respond to a bioterrorist attack. And during that experience, I realized that I really felt passionate around emergency preparedness, and this is something that I wanted to learn more about and pursue and help strengthen our county. After I received my PhD, I did my postdoc here at Children's Hospital Los Angeles, just across the street. And because it was a children's hospital, they focused on pediatrics. And I helped build up the resources, the training, the education material to educate everyone in Los Angeles around how to better prepare to respond and to take care of children during a disaster. What we found was that a lot of places thought, oh, well, children are just small adults. We'll do the same thing that we do for adults, just have everything be much smaller. And we know that doesn't work. And so my role was to bring awareness around the fact that children are not small adults and they have very specific needs and considerations that must be taken into account when we prepare for a disaster. I'm part of a few national initiatives around pediatric disaster preparedness. The first is funded by ASPR, and it's a consortium of 6 Western states. It's part of RAPM, which is the Western Regional Alliance for Pediatric Emergency Management. It's a mouthful. And as part of that initiative, we are divided into several focus areas. And I lead the health disparities focus area. And as part of that effort, I looked inward towards all of our focus areas and asked folks, how do you think about health disparities in your respective focus group? So for example, when it comes to medical countermeasures, when it comes to telemedicine, when it comes to pediatric surge, how are you thinking about health disparities, or are you thinking about them at all? And we found that one of the main issues was resources. There needs to be more funding in this area. Another finding was health literacy was a theme that carried out throughout all of those focus areas. There needed to be better education for caregivers around the needs of their children, especially if they have access and functional needs. I'm also part of a federally funded initiative by HRSA called the Pediatric Pandemic Network. This is a collection of 10 hospitals all around the U.S. That are charged with building up the capacity of our U.S. hospitals to take care of children during a disaster. The first piece of any impact that we may potentially have on policy is to bring awareness to the issue. So oftentimes children are overlooked when planning for a disaster. Again, we think they're just small adults. We'll do the same thing for them that we do for adults, and that's not the case. And so our goal is to bring awareness about the specific needs of children and what hospitals and counties and states need to do in order to be prepared and how they can help children and their families be prepared for a disaster. I'm very optimistic. I think COVID really highlighted some of our challenges, and thankfully children were largely spared from COVID. But we know the next big pandemic, the next big disaster is just around the corner. And so this provides us with an opportunity to really look at where the gaps are during COVID that we encountered and what we can do better and plan for better when it comes to children specifically.
Preventive Pros, the podcast, is produced by the Department of Population and Public Health Sciences at Keck School of Medicine of USC. To learn more about any of our episodes, or to subscribe to our monthly Preventive Dose newsletter featuring the latest in public health research and news, visit pphs.usc.edu/podcast. Thank you for listening.